Hi everyone. Welcome to this evening's webinar, How to Have a Good Day. My name is Naveed and I'm a UOK Doc Ambassador, and I'll be introducing you to the panelists today. Uh, First of all, we have Caroline Webb. Caroline Webb is an executive coach, author, and speaker who specializes in showing people how to use insights from behavioral science to improve their professional lives. Her book on how to have a good day has been published in 14 languages and more than 60 countries. She is also a senior advisor to McKinsey, where she was previously a partner. Our second speaker is Mr. Aman Coonar, a thoracic surgical consultant who has previously featured on our first webinar and has kindly agreed to step in at late notice. Mr. Coonar, other than his surgical duties, he's interested in research, teaching, and also mentorship. I currently work with Mr. Kuna, and having a boss like Mr. Kuna does make a day good. And last but not least, we have an aspiring GP registrar and founding ambassador, Mark Seaman. Prior to his GP training in England, he completed his MRCP exam in Ireland. I would like to take a minute to thank our partners, First Responders First and Jagus, who are our official sponsors. Lastly, UOK Doc is a charity. Please donate any spare change to the cause. In order to successfully receive your CPD credit, please fill out the survey at the end of the webinar. Without further delay, I will hand over to our co-founding trustee and psychotherapist, Chris Cherry. Chris, over to you, please.
Thank you, Naveed. Excuse me. Welcome to the three of you. It's such an exciting thing to have all three of you on, all bringing very valuable and important sort of insight and direct experiences across a number of different fields. Tonight's webinar is on how to have a good day. That's partly taken off the back of Caroline's book, which is a really excellent book. For anybody who hasn't yet seen it, do buy it and have a read of it. But particularly for medics, the medical profession. What I'd like to start with, Caroline, is, because we're going to look specifically at resilience. And I like to start from just the very simple, the basics. What is resilience? What do we mean by resilience?
Well, it's the ability to cope with ups and downs in a way that allows you to feel that you're somewhat close to your best self, even when things are not going as you choose, and that you're able to bounce back and that you have the energy to continue. And that adaptability, that agility is something that, oh my goodness, we need so much of in most complex jobs. But this year, and particularly in the line of work that people listening and watching to this will be, that ability to roll with the punches and still stay true to yourself and authentically making good choices is obviously, something that we're all striving for, and that takes constant work, but it can get easier the more that you work at it.
I mean, one of the things that I was particularly keen to look at, because Mark, you're part of a team, and Mr. Coonar, you're the leader of a team, and it's just very useful, interesting to look at the different challenges that you have in the different roles and positions. Do you have your own sense of what resilience is about in terms of your own role, your own position in your field? Mark, what's your sort of thoughts about resilience?
I guess for me, resilience is being able to take on new challenges and scenarios that happen every day and accept them for what they are and adapt yourself to them. I mean, on a team, and especially sort of as one of the junior team members, you have a lot of uncertainty in your day and you're frequently bombarded with new challenges, and being able to take each one on board with varying other stresses going on and managing those and dealing with them in a way that you would have wanted them to be dealt with in an ideal situation without the other stresses. I think that would be resilience for me.
Okay. And Mr. Coonar, what immediately comes to mind for you when you think about resilience in the context of being a leader?
Well, thank you for that question. I think let me answer it like this. I think that as a leader, we are very much part of the team. And that is hugely important. To me, resilience is about maintaining energy, and it's about making sure you can share that energy. And that, to me, is what resilience is, and that is what all of our roles within the team are, to some greater or lesser degree.
And I mean, when you talk about energy, you mean the energy of engagement, of curiosity, interest? I mean, how do you know?
I think the way that I would sum it up is feeling good and positive, and it's actually feeling a joy. That's the energy that I want, that I feel, and I want people to feel a thrill in what they're doing.
And do you see that partly reflected in the way you're engaging with the work? That you literally model that as a leader?
Probably to some extent I do, and I want people to be in such a way and working in such a way that they are rubbing good energy off each other,
yeah,
and growing that amongst themselves.
I mean, I'm reminded, Caroline, this is very central to some of what you've written about in the book, about energy reflecting resilience, the way of showing resilience.
Yeah, and I mean, as Naveed kindly said in his intro, my focus is showing people how to use insights from the behavioural sciences, so behavioural economics, behavioural psychology, behavioural neuroscience. And so at the root of this is something that you, of all people in the listening to this, know better than the general public, which is that stress can be good. As your levels of adrenaline and noradrenaline rise, your focus and attention and motivation rises. But beyond a certain point, then that tips us into a feeling of panic. And that's usually when we start to feel that a situation is not in our control. And that then is a very much blend of a mental and a physical phenomenon. It's not just in the mind, it's also in the body. And if we can tap into, if we can get more self-aware about what our tell is, what our how we know when we are facing something that our brain has perceived as a threat, and we can then have half a chance of pausing and taking a moment and using many of the techniques that then help us get back to our best self. And one of the ways that I've found very helpful to do that is to focus on the rewards in a situation, the sources of energy in a situation, as opposed to the sources of threat. So thinking about, okay, what am I grateful for? What is my sense of purpose here? What is it that I can do that is generous and is supporting other people? And by giving us back then a sense of our humanity and the sense of what's rewarding and joyful and purposeful in our work, that can be a very powerful way of reducing the sense of threat, help us then think more clearly, and get out of that state of alert. And a good leader is brilliant at doing that. And it sounds as if, Aman, you're radiating that and creating that sense of joy and purpose and connection that can really help and manifest itself in people's patterns of thinking and feeling very, very quickly.
Aman, is it something that you had to learn, or do you think it just came quite naturally?
I think it's a bit of both, actually. I think the environment that I was brought up in was quite influential in that. There are perhaps some cornerstones which I picked up on as a child and continue to implement now. I think one of them is that there are really no problems, there are only solutions. That is an important thing. Another thing is to pause before reacting, if you can. Another thing is that really most things are just very simple. One element of my background is that we're farmers, and really life is about as complicated as the sun comes up in the morning and then the sun goes down in the evening, and really nothing should really perturb you beyond that. I mean, that's really what's important, and the other things that happen during the day, they're just little ripples along the way. So those sorts of things have have been with me from the very beginning. Along the way, you just learn that those strategies seem to work.
When did you first? When was the first, if you can remember, when was the first moment that you realised, in that moment, you were the leader of the group that you were working with?
When did I first realise I was a leader? Well,
yeah.
Probably as a child. When it happens naturally, and then at certain points, some things happen. So I remember, for example, being somehow or other being made the captain of a sports team, and the team did very well. And I just remember thinking to myself, well, that went well. And it becomes positive reinforcement.
Yeah.
But can I just say, I'm more than happy for somebody else to take on a leadership role. I'm more than happy to hand over posts. I think that one has to allow other people to sometimes give the direction.
Mm. What I've seen in some of the most high-performing teams, both in healthcare and elsewhere, is that sense that everybody has a responsibility to create a productive working environment where people feel joyful and they feel that there's enough well-being and energy in the tank. Some of the things you've been talking about, I mean, so helping people reconnect to what matters and what's purposeful. I mean, we all have a very natural instinctive response to anything that gets coded as a threat by our brain. So anything that undermines our feelings of competence or autonomy, feelings of purpose, our feelings of fairness, inclusion, respect, anything that undermines those deeply human rewards, if those things are taken away, then we have an instinctive reaction to that being a threat. And if you can, in that moment, remind yourself that actually you are competent, there are things you know how to do. And you can do that with a colleague and say, look, you're really good at this. Like, I know this didn't go right, but you're really good at this. Or autonomy. Yes, I know there's a lot we can't control, but here is what we can do. And this is what you can do. Purpose, yes, I know it seems pointless having to fill out this form and so on, but, let's stay focused on what really matters in patient care. So we can do that for each other, whatever our formal leadership role, to reboot our sense of competence, autonomy, and purpose, knowing that that is so much the bedrock of our feelings of resilience when things don't go the way that you hope.
Caroline, you've used some terms there that I think are absolutely wonderful. I think that you just said confidence, autonomy, and purpose, and I think I haven't read your book, and this is the first time we're speaking, but you've broken down so many elements of what is, when I describe it, quite a nebulous experience into packages that people can work on. I think it must be really helpful for people coming into this and actually looking at how they can take it into packages.
Well, that's very nice of you to say. I mean, it took 15 years to distill all of this, so I wouldn't want you to think that, I just necessarily think like that. But it came from years of working with, I've worked with people in all sorts of fields, but, coaching chief medical officers and working with maternity teams and so forth. And, by seeing the patterns in what people react to, both, what makes people feel very stressed, and then, what it is that grounds people. And these are the things that come out in the research time and again. And it does help to actually have that little mental checklist, I will say, because when I start to feel stressed, which, believe it or not, despite having written how to have a good day, I can't actually suppress the instinctive reaction, but I can catch it early and I can label it early and I can say, okay, I feel stressed because I don't feel in control, and I don't feel in control because I don't have the information that I feel I need. Okay, but then what is there that I do control? Okay, it might be just my attitude, frankly, but then it gives me, those labels do help to say, okay, you can reduce the state of alert because I've heard you, brain, thank you, and now I can move on to thinking about solutions. So I appreciate the comment, and I also think that it can help to have your own little checklist of what could be going on here. Okay, and then what do I say to myself in response?
Mark, just as you've been listening to these sort of ideas and suggestions, how does it apply to the environment, the work that you're doing?
Very much so. I like the idea of the checklist. I think without realizing it, is something that a lot of people start to do as they go through their training, is start to recognize certain stresses that they have that are particular to them or might not be so particular to them, might be quite common. And recognizing that, stopping, taking a step back and saying, this is going to make me react this way, which isn't good, hasn't gone well before. I can do better than that. I can pause and direct my energy a different way. So I think that being able to label and recognize those different things are really important. And when you start at the very beginning, it's very hard to know your own tells and your own signs and things that make you do the things that you don't want to do or don't want to react in a certain way. But as you go through reflection, especially through reflection, you start to recognize what makes you a better person in your day-to-day job. And when you're starting to veer off that path a bit, I think it's really interesting. I think packaging it all up like that is a really good idea.
And when you think about what, so some of this is about reducing the state of alert in your brain. So, you know, labeling the threat, taking, as you said, Aman, you know, pausing, giving yourself a moment to feel your feet on the floor, or, you know, counting one breath in, one breath out. It doesn't have to be, you know, 15 minutes of meditation, just a kind of micro mindful moment to give yourself a pause and then to reconnect with what matters and say, okay, well, you know, what really matters here? You know, that reduces the sense of threat. What strategies have you found then bring back feelings of joy and motivation? I mentioned gratitude and generosity and achievement. There's a ton of them. You know, what works for you? What gives you back that energy when you're trying to get back on track?
A good patient interaction is probably the biggest high I get. So when you don't always realize until the end of the process you've been through, and you can look back at it and go, actually, I was really stressed at the time. I didn't think it was going well, but then I got this amazing patient interaction at the end. So it must have gone well. What went well and why did the patient react that way? And recognizing that you enjoy that moment and you get that buzz from a patient saying, you know, that went like, it doesn't even have to be them saying something went really well. It can just be a conversation that you've come away from and you feel actually they feel better. I feel better.
Yeah. And it's very easy to let those moments just go past and not to give them as much energy and focus as all the things that are challenging or might not go so well during the day. But I think it is a really strong, powerful habit of mind to get into the habit of looking at the end of the day and saying, okay, well, what were the good things? You know, what were those moments? You know, what were the patient conversations that, you know, yes, that went wrong, but, you know, what were the moments where I felt like I'm doing the job I should be doing? This is, you know, I'm in the right place. What about you, Aman?
Well, I don't really have many issues in the day that disturb me. But what I would like to answer your question by saying how I start my day, if I may.
Oh, yes, wonderful.
Because I like a lot of surgeons, and in fact, a lot of doctors, like a lot of people, I actually tend to wake up very early. And in the summer, I'll wake up around 3:30, 4 a.m. In the winter, it'll be about 4:30, 5 a.m. And at that moment, I'll usually wake up suddenly alert and thinking about something. It doesn't matter what it is. I'll be thinking about something that is usually a problem. And I went through a period of time whereby I'd dwell on that problem, think solutions about it. And actually, I wouldn't be at all relaxed. But what I did was I switched it immediately to who am I going to help today?
Yes.
And I find that wonderful, actually. And I don't know what it is. I'll just think of somebody that I'm going to help out today and be nice to, or maybe it's a patient, but it's often somebody that I'm likely to encounter on the way into work. And all of a sudden, your mind just switches to a really positive state. And then as early as I can, I will look at the plants in the garden, and I'll take their energy. Yeah. So that's my answer.
I really like that. And that's, I mean, the research on the effects of even just thinking about being generous to other people, absolutely bear out what you're saying in practice, that the effects of being generous, even thinking about being generous, thinking back to something you did last week that was generous, has been shown to create a very significant boost in well-being. And it's, you know, in a field where all of you are doing inherently, you're in service of others. There's more of those examples that you can reach for than a lot of people, to actually say, okay, well, what is it that I'm going to do that is going to be generous and helpful? I really love that that's a practice for you. I will say I'm a complete opposite chronotype. I would lift myself, I would go to sleep at 3. So I can
sometimes go to sleep at 3 as well.
I can vouch for the fact that this works for people of different chronotypes, even if you're not as much of an early riser as Aman is.
Yeah.
But you've positioned yourself in that moment, as I hear it, you've turned your attention onto something that just in the thinking of it makes you feel, it relieves the stress. It changes the mood that you're in. The sort of, I suppose, Carolyn, the feedback, the loop between the mind, body.
Absolutely. And, you know, for those who are interested, there are studies. I mean, you know, there are always issues with how much you can really truly tell in studies that use fMRI scanning. But, you know, there's enough solid evidence there that there is a reduction in the state of alert when people are facing stressors or negative imagery. When you invite them to do some of the sorts of things that we've been talking about, then you do see that reduction in the state of alert. So, you know, there are real things that we can measure, that we can see are happening, as well as self-reported increases in well-being.
If for whatever reason it's not possible to sort of shift your attention to something positive, and do you have your own suggestions of how you not so much survive the anxiety or the stress, but that there's a way of managing it, even if it's not quite dissolved, relieved?
Yeah. I mean, I have a little routine which I call notice, pause, reset. It's not that different to what we've been talking about, to be perfectly honest. You know, so as we've said, just the sheer fact of labeling an emotion reduces its grip on us. Actually, interestingly, this is true for positive emotions as well as negative emotions, but, you know, we're mostly interested in reducing the size of the impact of negative emotions. So labeling, you know, noticing, I seem stressed because I don't feel in control, taking that pause, taking a moment, whether it's, and actually, I also like looking at plants. I have plants behind, as you can see, I have plants, you know, and I will look at a leaf, and that will be my single point of focus and my moment of calm. And then to have a reset question. So it could be, you know, who am I going to help today? It could be, you know, what does my best self think about this? You know, if you can't quite get to who am I going to help, maybe that's too much of a stretch, as you say, Chris, you know, but, you know, you can say, okay, what would my best self do? Or if I look back on this in a year's time, what will I be really glad I've done? What will I be proud about in the way that I handled this? So adding a bit of distance from the technique, from the situation, adding a bit of distance from the situation can be extremely helpful additional tool in your toolkit, whether it's putting yourself in a future time, putting yourself in a better version of yourself. These have also been shown to reduce the state of alert when you can't quite get to the, why is this actually amazing? If you can't quite get there, then asking yourself a question that gives you some distance can be a really good way of finding a way forward.
Mm-hmm. Mark, because you're particularly sort of tap into exercise, don't you, as one way to build resilience and cope with stress?
Yeah, I think it's meditation through movement. So I like to, if I've got a particular problem or something that's bothered me during the day, almost the first thing I do when I get home is go for a run. And by the end of the run, whatever was in my head that's been running around will have left my head, and I'll feel much better afterwards. And it's probably a mix of the endorphins I get, the fact that during the run I've processed whatever it is and worked out actually it probably was okay, and I feel better about it. So yeah, exercise for me is a big thing. I also really like journaling as well. So I like to unload it in some way. And sometimes I combine the two. So if there's something that's really bothered me, I feel too frustrated to go for a run, but I want to get it out, I'll jot on a piece of paper, you know, just one word or one thing that's really made me not so happy about that day or that scenario, go for a run, come back, look at it again and be like, actually, it's fine. It's fine. I'm okay. It was good in the end.
That's great.
Is the culture, the sort of discussion or just conversation about emotional and mental health, is it much more common with your peers and colleagues, Mark, now?
I think it's become a more open topic, yeah. Especially since COVID, actually, I guess, because everyone's talking about well-being, and people are doing a really, really good job of checking in on each other. And we brought it up again recently in one of the teams I worked in, where we thought we should bring back some of those well-being checks into the team. And just because the COVID rotas have changed and the teams have changed, we should keep those well-being checks in, because some of the stresses, they were just the same then as they are now. They're just under a different name. So,
what do you do when you say well-being check? What exactly do you do?
It's sort of, we often have catch-ups during the day with the team, because we all get strewn across the hospital to do different jobs. And we come back and check, is everyone okay? Has anyone got any worries, any struggles? And it is often towards the end of the day, is everyone happy to go home? Everyone safe to go home? Does anyone have anything that's really burdening them that they shouldn't be taking home with them without chatting about it?
That's excellent. That's really excellent.
It's really, really useful.
Yeah, it's like real life human journaling, actually sort of getting it out and helping you process it. That's really wonderful.
Aman, it seems like you, in the way that you were saying about the sense of being a leader from a very young age, have you got your own examples of where you actively brought in new ways of approaching things that attended to people's emotional well-being as you became more sort of a leader in the field? You've muted yourself, Aman.
I think that being approachable is very important. I would like to think that I'm approachable, and sometimes people tell me I am, and I often I'm quite surprised at when new doctors are so sort of tentative and cautious. I wonder what sort of traumatic experiences they've had before. So I think that's important. You have to allow people to talk. You have to encourage people to talk. You have to be open. You've got to accept the issue of being challenged, and actually almost encourage it. Sometimes it gets a bit disruptive, but I think it's very important to do. So that's a sort of communication style. One of the things that I've really enjoyed being able to do, and I was helped because it became enforced in the NHS, was to have a team brief at the start of a case, and which almost followed a checklist, but now it's become automatic. Now, I view that and I value it as almost as a religious experience. I think of it as a congregation coming together, and my team may or may not notice. I think Naveed has noticed at one point, but I actually cross my hands when I'm doing it. And I actually feel that that's a moment of, we're talking about the operation. We're saying this so-and-so has got these problems. We're going to do this operation. We need this sort of kit, and these are the issues that we have to attend to. But actually, what we're doing is we are coming together and affirming a common purpose. And I just love that moment, actually. I really do. I mean, in the back of my ear, I can hear the hymn singing from school quietly, because actually it takes me back to that same sort of state. And so that's something I've enjoyed doing, and I think it does help people. I think praise always helps. And I'm not the best person at criticizing. When I criticize, I don't mean to criticize, but I mean to guide. And I'm sure I can do better with that, because you see people take it in a way that's beyond just the, well, put the stitch differently. It's a sort of, it's an emotional hurt. and hurting people emotionally does not bring the best out in them.
Yeah. You're spot on. I mean, in a way, criticism is perfectly positioned to trigger all of those sort of that basic sense of threat that we were talking about earlier on, that feeling of our competence and our autonomy being challenged. But I love the fact that you're talking about giving praise, because one of the ways that I've seen leaders really do have people better able to hear criticism is to say, you know, what I really like about the way you're approaching this is blah, 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 blah. And some version of, you don't have to use these words, what would make me like it even more is, and that pairing is a way of having someone not be on the defensive when you give them the feedback about how they might change or develop or grow. But of course, it does require you to have some things to say, some really specific, genuine things to say about what you like and what you're observing and what is working well. And I think a lot of leaders give general, yeah, you're doing great. But actually what's really powerful and what earns you the right to then give feedback in a way that's heard is to really make the positive observations as specific and factual and real as anything you might say on the developmental side. So I think you're right that, you know, the two go together. The two absolutely go together.
I want to be in your team. It just sounds great. Mark, some other thoughts from you about what we're speaking about?
Well, I think, I mean, Aman, it sounds like you're an amazing team leader. I think that those are strong positives that everyone can take on, and everyone in a team, I think, has a leadership role, and we all gravitate to our own little strengths, and supporting each other's and recognizing each other's strengths and their positives and feeding back to them is always helpful. Yeah.
We often assume people know what they're good at, but we get very little feedback on, you know, you handled that really well. And specifically, I like the way you did this because then it had this effect. And, you know, actually we learn as much from knowing that there are certain things we do. They might be unconscious. We might never do them again. We might have done them by mistake. So to actually be told, oh, that worked really well, what you did, is important reinforcement. I mean, it's often something that we don't think is needed. And if we're talking about resilience in general and having a good day and having the ability to have a good day even when things are tough, then having that sense of appreciation coming at you is a really, really important part of it. And of course, if you don't have an amazing boss to do that, then to think about that for yourself and to say, okay, well, what do I think I'm good at? What do I think my strengths are? At the end of the day, to say, what do I think went well? What do I think I handled well? That is something that we can also do for ourselves, and is one of the most powerful and sustainable interventions that you can do, whether it's to take a journal like Mark does and write things down, or just to kind of lie there as you're going to sleep and think about whether it's at 3 a.m. after a long shift, or whether it's at 10 p.m. to lie there and to think, okay, well, what were 3 good things today that I can take into my dreams? So I think, you know, this importance of positivity and appreciation is something that is crucial, and we can do for ourselves to an extent, and it gives us more resilience.
Do the two of you see some areas where things can still continue to be evolved? I mean, both just the culture of the medical profession, or specific, whether you're a GP or a surgeon, do you see things that still need to be attended to, sort of continue to develop?
Shall I start off with that?
Yes.
Yeah. So I think we have to recognise that there are big mental health issues within healthcare, within the healthcare profession. I think a lot of them relate to a combination of overwork, and I use that term carefully. It may not even be the actual hours of work, but it may be the intensity of work. I think they relate to sometimes, not in my organization, which I think has got a very positive culture overall, but I think that it relates to a lack of praise, a lack of understanding of the traumatic experiences that people are being exposed to. I think with the COVID experience, although of course we're way more confident in how we're dealing with it than we were in March, I think that there were and are massive worries about to personal health, which have been variably addressed. And when I talk about healthcare people, I actually mean everybody in the healthcare team. I think it is a great tragedy that so many frontline people, cleaners, porters, ambulance staff, bus drivers, had such worse outcomes than people who you'd imagine were far more exposed, intensive care unit staff, because they didn't get the right protection, which we in a hospital that works with airborne respiratory diseases all the time, I mean, it was just barn door obvious that they needed protection. So I think there's a great deal we can do. And I think that we have to recognize that to have the best performing workforce, we really, really need to look after them, all of us, not them, all of us. And if we're going to get 10% more out of everybody, the kindest, best, most effective, most joyous way of doing it is to care for each other. Mm. And that, I think we need to evolve in that direction. Carrots work, sticks don't.
I mean, do you think there are specific aspects of the culture of the medical field that have in one way or another placed obstacles in that? I mean, in a way, it's a paradox, isn't it? The work you're doing is about caring for others. And is it the culture? Is there something about the history of how the medical profession evolved, that meant that wasn't really attended to or sort of thought about?
Is that for myself or for Mark?
Yeah, no, Aman, yes.
Okay, so I'd like to pick out two themes in that. The first one is the self-expectation and to what extent that becomes damaging. So today, I was interviewing some people, and the people I interview are always brilliant, all of them. And one of them said to me, in fact, maybe more than one of them said to me, they said that hours are not an issue. I will work day, night, weekend, all the time, and you don't have to pay me. I mean, words to that effect. And I saw that, and I saw myself at a younger time in that, and I thought to myself, really, is that what we really want you to do? Do I really want you to do that, or do I want you to go and play football on a Thursday afternoon and come back on a Friday invigorated to a new level? I mean, that was my silent thought to myself. Mm. And so there's this self-expectation, which is okay for a period of time. And stamina is very important, variably in different branches of what we do. And it is very important in surgery. But I think that self-expectation and the demands on can become damaging. And I know I've damaged my own health. I think I'm in a better place. So that's one aspect. The other aspect is the system expectation. Now, some people might translate that to tough management or administration, but actually, I don't want to do that. I actually think that 99%, if not all the managers in the healthcare system want it to work. But it's about the way silos exist, and it's about artificial expectations. So if your metric is how many patients do you see in a clinic, I mean, that's really nonsense. It's so nonsense. It's not related to any health outcome. It's got to be along the lines of how many successful interactions there were in the clinic. How many times did you stop somebody coming back to another clinic appointment? You know, the metrics are wrong. So if you force people to follow the wrong metrics, you're going to get the wrong outcome. So we need to think carefully about how we are going to deliver patient-centered healthcare and maximize our staff ability.
I started a charitable effort earlier on this year called frontlinehelp.org to provide free coaching to frontline healthcare staff of all types. So, as you say, receptionists, cleaners, doctors, nurses, everybody welcome. And we discovered something which I guess, you know, is obvious, which is that if you are in an organization, if you're in a career where your identity is so tied up with supporting others and helping others, there is a challenge in then saying, I need help myself, because you have a sense of yourself as being the rock, the person that other people reach out to. And so we actually had many fewer people reach out for support than we had hoped and expected. And that did obviously get me thinking. I mean, you know, one of the reasons that I've always been drawn to working in healthcare is because of that mission driven, that sense of purpose. But one of the ways that I've found, one of the only ways that I've found to get people in healthcare to take a break and to invest in themselves is to understand this point about stamina that you make, that actually, you know, there's lots of evidence to suggest that when our brain takes a rest, it's not resting, it's continuing to process. You know, when you go for a run like Mark and you come back and suddenly you can see freshly and with more insight, that's a real thing. You know, when you step back, you don't take a break, really. You don't, it's not that you're kind of being soft. In fact, it's part of high performance to take a break. And
yeah, I agree.
You know, I think that unless you position it as this is about high performance and helping more people, it's very hard to get very mission-driven people to take a break. But I have found that that's the way, is to say you will create a more sustainable model, you will reach more people in a better way with more insight if you take breaks from time to time. And here is the research, by the way, that says this is definitely true.
Yeah. I think healthcare organizations, in fact, all organizations, I think they'll benefit from that if they practice and advocate that, because I think that they will get better workers.
Yeah.
Can I just make a little observation here? I've come relatively recently to professional social media, and I've recently started to use LinkedIn a bit more. And I'm not plugging any particular channel, but I just have. And I put a post on it about the security team at Royal Papworth Hospital, who are employed by a company called OCS, who is a big provider of people for all sorts of organizations, but particularly healthcare. And so our restaurants, porters, and so on are employed by them. And it has been the highest observed post I've ever put on. And really what I was just saying is, it's very nice, I'm going to be in a BBC show, but the outcome is just because we have a team, and these people who are manning the security at Papworth are just as much part of that team as the people in theatre and all the other people. And I think that I think we have to look at that group as well and their needs. So it's great that your frontline project is accessible to them.
Yeah. No, we were very clear on that right from the beginning, that we wanted, I mean, you know, having worked in health systems, we know that it depends on absolutely every piece of the system. And we knew that a lot of people in all parts of the system were feeling stressed and worn down by all the things you mentioned with the pandemic. Absolutely. Yeah. So frontlinehelp.org, by the way, if anybody would, you know, would like someone to talk to for 60 minutes free of charge, then please go and take a look. But more broadly, of course, just having a culture where you're talking about this stuff with your colleagues and saying, you know what, let's get better at taking a break. You know, let's get better at just taking 10-minute breaks and just going out and stretching our legs. And, you know, if you can do that together, you're more likely to succeed than if you just try and do it for yourself.
I mean, I think one of the things for me about this conversation that's part of all of the webinar conversations is just the normalizing of these, of the topic, of the issues, of the common experiences that you're all talking about, and how normal it is. I mean, Mark, I'm very keen to see some of your thoughts that you've been having while you've been listening for the last few minutes.
I really agree with Aman's point on the overworking not necessarily being the hours you do, but the intensity. You know, the number of human beings on the shop floor remains the same, but the actual intensity and the amount of work you varies greatly through day to day. And people's batteries are only so full, and taking those breaks to refill those batteries are really important. And again, going back to doing things together as a team, to having that, the teams I worked best in and enjoyed working in the most of the ones that we've taken those coffee breaks together. They're not part of your formal lunch break. You go and have a coffee break. You can have a chat about not necessarily what's going on, but it's an open and safe space to unload any worries, and you bond together much more because you talk about what you do outside of work, and that's really important. I think to remember that each member of your team, they're not just the doctor, the nursing assistant, the porter. They're a human being as well with life aspirations that they want to talk about, and that always has helped in every team I worked in. Just talking about the things you enjoy.
I mean, one of the things that I think you're all talking about really is just a conscious sort of act of kindness to people, sort of relating to people, sort of engaging with them in a way that's kind and caring, acknowledging of things, and how much that, from the sounds of it, just builds a resilience, a robustness, a sense of positive tension between people as a team.
Yeah, and that resilience in turn translates into high performance for those who, are thinking, well, this all might sound a bit soft to certain of my colleagues, that we perform better when we're not feeling threatened because our brain is not diverting huge amounts of mental energy towards a defensive response. And we are better able to think through challenges at hand if we have that feeling of appreciation around us, if we have that sense of purpose, and we have enough energy in the tank, both physical and mental. And so, yes, I think if we can talk about ourselves less as machines and more as sort of living, breathing creatures that we are, and that we need all of these things to be at our best, to perform at our best, then I think that would advance the well-being, but of not just people in the medical profession, but also the patients too, ultimately.
Chris, may I just say, I'm very glad you mentioned the point about normalizing these conversations, because certainly when I was in training, it wasn't done to talk about these things. It was definitely a sign of weakness. People would, when somebody expressed those sorts of things, the banter and sometimes more seriously, the actions were to exclude them or marginalize them. So I think that being open about these things is really important. And I've learned those things along the way.
Yes.
Yeah. It's really powerful when a leader is vulnerable. Well, vulnerability is a word that's a little perhaps overused these days. When a leader is open about the challenges that they're dealing with and how they handle themselves, as exactly as you both have today, it creates a feeling that it's okay to talk about it. So I think if one thing comes out of this webinar, if people are sort of feel readier and more willing to dare to open these conversations with colleagues, it's going to really send a ripple effect. If we're willing to talk about it, then other people will open up too.
I suppose it's a building of being confident and comfortable to talk about these things. I mean, just literally the people that have been on the webinar, the doctors and so on, being able to talk about this in just a very straightforward way, to me, seems one of the most powerful bits of these conversations. And just talking about them without them being overly dramatic. This is just what happens to people. It isn't necessarily a sign of somebody's failure or inability to tackle the things. It seems a good moment to open up the floor to all the questions that I think have come flooding in. Naveed, what are some of the questions? What's the first question?
There are a lot of questions. I'll start off with the sensitive one, and a couple of participants, they have asked this question. So the question goes like, workplace bullying and belittlement in the NHS is sadly very common and can have a detrimental impact on staff day-to-day well-being. Ideally, we could report this, but that's just not an option. what is your practical advice for anyone suffering from that to keep mentally strong in the moment and the long term?
So you're talking about bullying and belittling, people feeling they're getting negative sort of messages or ways of being with them. Is that right?
Yes, that's correct.
Who would like to start?
Do you want me to say something?
Yes, go on.
Yeah. Okay. So look, let me tell you what I've done in the past when it's happened to me, and it's happened many times. Number one, okay, you've got to have some self-worth. Okay, and that's easy for me to say now. And when you are at points in your life, you may not have that confidence. You may have uncertainties. You've still got to do the exams. You haven't got the confidence. But just believe in yourself. You know, you're the peak of human evolution. You know, nobody has come before you and nobody's come after unless you've got kids now. So, you know, you're the product of millions of years of survival and evolution, and you're highly capable. So number one, have some self-worth. Number two, remember that things always get better. Okay, if things are going to get worse for a while, they're always going to get better. The next thing is realize that whoever is belittling you or undermining you, they have the problem. You don't have the problem at all. They, for some reason, don't even think they're pathetic. Try not to feel sorry for them. It's difficult, but they're just having a bad day, and they're unfortunately taking it out on you. And turn that experience into a lesson. Promise that you won't do that yourself in the future. Those are some of the strategies. Now, it can be extremely difficult, and I have been in a terrible situation once or twice where the autonomic response that Caroline so eloquently spoke about took over. And you're in this fight or flight situation. You can't run away because you've got a patient, and please don't hit them. Okay, I have come extremely close to doing that. Just take it in and react later. Okay, just move to a point of safety. You know, if you're unwitnessed, move to somewhere where there are other people. Okay, keep calm. And the other thing I haven't said, and I think this is very important, and I've always done this, talk to someone else. Okay, and if you have to write it down, write it down. But I have to say, you know, I sort of agree with you that reporting everybody's going to have their own solution, but reporting it, I don't know if it will solve the problem. But you need to document it somehow. Mm-hmm. Other people may have a different point of view. Anyway, I've said a few words.
I think if it's really egregious, it's very helpful to get it on record just so that people can see whether there's a pattern. But I think absolutely, you know, really, as someone, I mean, I've faced bullying as well. You know, I think that you've got to be realistic about the fact that it can happen, and it doesn't mean it is absolutely true that you know, 1% of the population has psychopathic tendencies. So, you know, you will run into the occasional person, possibly less in healthcare than I think elsewhere, actually. I mean, I think that there's people with psychopathic tendencies tend to cluster, perhaps not in service roles of profound service. But yes, I would echo the point about making sure that you've got other people around you to talk to so that you're diluting the effect of this one person. I think absolutely. I think it can help to actually imagine a scenario that could be causing their behavior and to have some fun with it. So I wouldn't, you know, I'm not encouraging you necessarily to be rude to them, but just to imagine, you know, what might have happened to them as a child that might be causing this behavior, you know, and by giving yourself a moment of levity, it can reduce your sense of stress and threat and help you think more clearly about what to do. I think journaling, and going back to what Marcus said, I think it's helpful to journal this sort of thing out. And I will say that there is a situation in which sometimes people don't know that they're being complete assholes. You'd think they would, because it's kind of obvious. And yet I have run into situations where people just thought that they were telling it how like it is, and they were being very direct, and this is just my style, I'm just very kind of all out there, you know where you stand with me. And they didn't realize that their so-called direct feedback was actually basically, verging on bullying behavior. And so there is some benefit I've seen in many situations to actually sit down and talk to the person and say, look, when you say that specific thing in front of a group of patients or whatever, or colleagues, the way that it makes, the effect that it has is this. Be very specific. When you say this, it has this effect. Tell me more about, what is going on here, and then what is there that we could do differently. And I know that it feels like, well, you can't possibly do that with your boss, but actually I've seen this work in every direction, up, not just one level, multiple levels. If you stick to the facts and make an observation, describe the impact, and then say, okay, what can we do? It doesn't work always, but sometimes the person just doesn't know what they're doing. So I'd encourage you to consider that, at least consider that.
It's literally the act of doing that, I imagine, has its own value. I mean, ideally,
it gives you back a sense of control, and the guy or the woman might end up not changing at all, right? I mean, let's be honest, we have to be realistic here. It may not change anything, but it gives you back a sense of agency.
Yeah.
And it's an important step to try, because there is a possibility, as Aman says, they are having a really bad day. Maybe they've been having a bad year. Maybe it's a bad decade. And they've got so ingrained in these threat-based responses that they're lashing out. They're in fight or flight mode. They're constantly biting people's heads off. This has become a patterned response for them to stress. Now, it does not to excuse it, but there could be all sorts of things like that going on, and actually sort of calling them on it could actually be a bit of a gift to them, even if it's not immediately something that moves the situation forward. It's a good thing to do.
I mean, one of the things that I'm increasingly sort of interested in is the different versions of ourselves in different situations, different environments, and coming at it as an opportunity to learn, to experiment, to explore different ways of being with people. Just literally the act of doing that, irrespective of what the person does or doesn't do in response. Caroline, what are some of your thoughts about versions of self? Because I think you speak about it in the book.
Well, I'm mostly interested in knowing what the best version of yourself is, and then figuring out how to be that more often, all the things that we've talked about today, and just starting to identify what it is that knocks you off balance, and being systematic about developing a repertoire for when you encounter those situations, and starting to build up your capacity, your resilience over time, with all the things we're talking about. What is a personal operating model that is going to serve you well? How do you want to think about breaks? How do you want to start each day? What intentions do you want to set? How do you want to close each day? What norms do you want to bring into a team? How do you think about getting a little exercise, knowing that that's going to boost your levels of serotonin pretty quickly? Yeah. Not to mention blood supply to the brain, and help you think things through more clearly. I think developing then a kind of personal operating model that is flexible enough to roll with the realities of your work, which may change in their timings every single day, every week. If we can kind of work towards that, and it's going to be different for everybody. Aman's is going to be very different to mine, given our different chronotypes. Mark is young and enthusiastic. I can't go running, but I can walk. So we all have our own way of finding our groove and our ability to be our best self.
Mark is 55. But your own thoughts, Mark, about that question, your own.
Yeah, I mean, I think it's very good what you said about putting it back on them and labeling what has happened in the situation to them, to open up a discourse, because I don't think most people want to be cruel and petty and mean to someone. And when you tell someone, oh, actually, it did make me feel this way,
right,
it might make them feel bad about that interaction themselves, and then it might make them open up. Why did they do that? It might make them think. And And that could improve if that's someone you're in a team with, that might be a bonding experience. You might both open up about something that neither of you have spoken about that might be important.
Yeah.
And I definitely think, documenting it, you have to document everything nowadays. But documenting and talking with your supervisor, that can be a cathartic exercise in itself, because you're talking with someone who isn't necessarily involved in the situation, and they can give you feedback on it. And then not only is it it's recorded somewhere more official, but then you've talked about it, you've opened up and you've said how you felt about it. I think that's important.
Someone in the chat has just said, what if the person who's unfriendly to you is your clinical supervisor? What do you think about that, Mark?
Well, so that's very tricky. If your clinical supervisor isn't being friendly to you, is there a possibility you can change clinical supervisors? As trainees, we all have educational and clinical supervisors. Your educational supervisor looks after you for your entire year or training scheme, and your clinical supervisor looks after you for that one job. But there's often multiple clinical supervisors within that job that are looking after a number of people. So if it's a really big problem, changing clinical supervisors can be a way that you can deal with that.
Yeah. And again, that clinical supervisor may never have been told, when you say things that are like this, when you said that thing on Thursday, the effect that it had was. And the more specific you can be without any emotion on top of it, just very specific observation. The first step is actually to talk to that clinical supervisor. And then, as Mark says, to, recognize that there may be other relationships that you need to build, and move towards those as much as you possibly can, and get your sense of satisfaction and progress from them, rather than the person who's technically your line supervisor.
Because I've definitely had that experience, and then you can talk about with your education supervisor or your clinical supervisor if it's the other way around, and then you can normalize the situation. Like, actually, if you feel you're not getting on well with that clinical supervisor, and they're picking on something about you, the education supervisor, like, that's not you. I know you. This is how things are, and that can actually be more settling, I think.
Thank you, Mark. Naveed, another question?
Yeah, the second question is, what are the best way to manage a stressful situation at work? How can you make yourself bounce back from the situation at work?
Caroline, what are your immediate thoughts?
Well, that's what we've been talking about. And I think that question came in at 9 minutes past 7 UK time. So there is a chance that Alvin, who asked the question, you might feel that you have more of a handle on that at this point. I mean, I think, just to reiterate some of the things that have come out of this conversation, I think, just developing that self-awareness to notice when you are in fight or flight or freeze mode, and to label what you think the trigger might be. I feel like this because of that. To take a pause, to take a breath, and then to ask yourself a reset question that reconnects you to your sense of joy and purpose. That is going to be that is the workhorse. That is the central first line of response that helps you recenter in the heat of the moment, I think. And then, all of the other things that we've talked about, taking breaks, showing yourself appreciation, showing other people appreciation, thinking about generosity, all of these things are going to help you, even in the middle of a difficult situation, to say, okay, well, what is the point of all of this? What is good about what we're doing? Where are things working? These are questions that will help you and help restore your sense of clarity in the heat of the moment.
Thank you, Caroline. And I think the next question goes to Mr. Coonar. Someone asked, how much sleep is needed? Much less sleep makes one stressed, isn't it?
Well, my answer to that is lots. Everybody's different. You have to find out what's right for yourself. The people who find that they function well and are comfortable without as much sleep as others might find themselves going in one direction. People who need more sleep may find themselves going in a different direction. Listen to your body. Try never to lose that insight. It's difficult. I'm not the best example at various stages of my career, but do what you need to do. that's really the best answer I can give you.
Yeah. I burned out in my mid-30s because I thought that I was sort of invincible. Was it my mid-30s, early 30s? Anyway, as you get older, it's hard to remember. But anyway, I did burn out. I mean, so yes, I had a virus. Yes, I had, a long tail recovery. Yes, there was but it was caused by stressors in my environment that had been building up. And it's one of the reasons I got so interested in these sort of small daily habits about how you can create, the kind of daily routine that is going to allow you to function at your best. And sleep is so much core to that. And there is a bell curve. There's a normal distribution around 8 hours. And, personally, I'm at 8 hours 15, sometimes 8 hours 30 minutes, So you've got to know that. You've got to know that. And then you think, okay, well, how can I then optimize around that? And that has meant making certain choices in my life. It didn't mean that I was a partner at McKinsey, the consulting firm. I was, able to function, even though I needed a lot of sleep. I was better able to function once I recognized how much sleep I needed and invested in it and protected it. And then, actually my performance got much better, and I was able to do much more with with what I've been given. So, I think I'd really, really echo that. And you have to kind of test it out, and you have to, try out, how much you need when you're not constrained. And of course, it's really hard to get as much sleep as you like. But, naps, the evidence, the research on naps is really quite encouraging. I always carry an eye mask and earplugs with me, even kind of a blow up cushion that allowed me to, to just take a nap anywhere. Once I realized how important sleep was, then I was willing to get it in any way that worked.
Yeah, it's also not only the duration of sleep, but it's the quality of sleep, and it's the timings that work for you. So I know for myself, although it's contracted a bit now, but between 2 a.m. and 4 a.m., I really don't like to be woken up. So when I was resident on call, I would strive to make that window completely clear. So everything was done before I sleep. And so long as, if I went to sleep about 1:30 in the morning, and if I didn't get woken up till 6:30, it was a miracle. And it was not only, it was wonderful. And I'd be totally alert for 24 hours after that. But I'm not, I don't have that same level of stamina, but I still don't like the 2 to 4 a.m.
Yeah.
Just one thing you said before, Caroline, just because it's always useful just to sort of inform people a little bit. What do you think the key elements of recognizing burnout is? Do you have your own sort of checklist of what a burnout would be?
There are lots of different versions of it. I think it's when you know that your body and your mind are worn out, and that because your body and your mind are a system, it's hard to say this is the checklist, because you can find that things are flashing amber in all sorts of different ways. So I think for some people it presents as stress, as a feeling of, I've seen it happen where people are less able to do all the things we've talked about. They're less resilient to uncertainty, to changes in the environment. For me, it presented itself very physically. I mean, I just fell off my perch. I was dizzy every day, and it ended up it was a sort of an infection of the nervous system. But it didn't mean that the sort of mental presentation of it was less real than the physical presentation of it that I had. I think that, we're all one system, and so stress, excessive allostatic load that builds up over time is going to present itself somewhere in the system, and you can't be sure where it's going to come. But just know that if you're not feeling at your best, it's not something you should just have to power through. I think this is what this conversation is all about. It's actually okay to stop and say, okay, something isn't working. I can do this for a certain amount of time, but I need to change something in my routines because this is not sustainable.
And do you think fragmented, broken up, inconsistent sleep is a red sort of flag?
It can be. It can be. I mean, it wasn't particularly for me, but no, absolutely it can be. I think if anything starts to sort of go a little awry in your physical or your mental state, I mean, of course, that then throws the net very broad. But I think burnout is not a kind of point at which you flip not binary. You're not kind of burned out or not. It's a progression. It's a kind of sense that the system is not in equilibrium in a good place. You can be in equilibrium in a bad place. It's not in equilibrium in a good place, and that you need to tweak the settings.
Yeah. And Mark, because I know you're particularly I mean, sleep is a very important element of your daily routine in terms of your emotional well-being.
Yeah, I think like everyone does, I kind of disregarded sleep in my 20s and throughout my uni years and my early years as a doctor, and I thought I could do it all, burn candles at both ends, work, study, do everything. And I realized it was really affecting my ability to concentrate day to day, and ability to take on new challenges as well. Sleep is just so important, and like you've been saying, that finding your right balance for you and finding that right sweet spot for hours for you is really important, and it is about quality and not quantity. It's fairly easy to track now. You can track your heart rate overnight, and it can give a crude estimate of what your sleep's like, and you can find things like alcohol, tea, coffee, having exercise before or after, what actually means that you get a good night's sleep. You can fairly easily track it nowadays. And I think that once you find a pattern that works for you, you will find that things are easier during the day, and your mind body balance is improved. And I definitely think sleep is something that isn't taught very well to medical students, which is a shame because it's something that they don't get enough of.
You might be surprised where you sleep the best. I end up sleeping in all sorts of odd places, and recently I found on the sofa with the puppy seems to be the best.
We should all be issued with puppies, I think.
Puppies.
Well, it's the only way we can get the puppy to sleep through the night.
Oh, that's great. That's great.
Just because of time, see if we can get a few more questions in, Naveed.
Yeah, so the next question is, how do you think we can embed how important well-being is within the NHS? How can we be better at looking after each other?
Caroline?
Well, I would defer to the two people who are actually working in the NHS, really. I mean, I think that the more that leaders talk about it, the more that it is included in a leadership model in the assessment of, how people are leading their teams, the more it's included in, annual reviews and saying, okay, well, how are you doing? Okay, what's your personal operating model? Is it sustainable? Having that conversation embedded, in that way, makes a huge difference. But what do you two think?
Yeah, I think, be the pioneer, bring that conversation into your team, make it a normal part of your team discussion. I think that's what will bring it in is more of the juniors and the members of teams start talking about well-being and making it an important part of their everyday. It will become a normal part of the NHS and the team setup. But so yeah, be that pioneer. If you aren't seeing that in your team, why not be the one that starts the conversation?
Yeah, well, I agree with both of you. I think it needs to be normalized. I think that everybody needs to talk about it. I suppose the added thing is that it's helpful if there's so-called top-down encouragement of it.
Right.
And it needs to be embedded in the culture. It really does. It needs to be so normal.
Yeah.
People need to be saying, "Are you okay?"
Doc. or nurse, or nurse assistant, or porter, or ambulance worker. Yeah.
One final question, Naveed, before we have to finish.
So I'll choose this one because two people asked how to best support a colleague whose guilt and shattered confidence as a result of error incident adversely affected their future performance.
So how to support someone who's gone through quite a traumatic sort of work experience?
Yes, the results of an error.
Yeah, as a result of that. Aman, what's your immediate thoughts?
Well, Naveed, I haven't read that particular question, but it sounds like whatever has happened, that person is currently almost sort of in a destroyed state.
Yes.
which is a very serious situation to be in. And so such an individual needs urgent restorative help. And if somebody can see that there's a problem, but that person can't see there's a problem, they almost have a responsibility to raise it. They need to tell somebody who's capable of helping within the organization, if that person's in an organization, and that person needs support and sustenance. And maybe that means they need to have a week off. And maybe they need to actually sit down with somebody, go through the steps and rebuild themselves. I mean, the details of that really will make the difference. So what sort of error was it? Where did the error lie? There's lots of aspects that can be worked upon.
Yeah, and the more that you can help them, and this is true, someone asked about autonomy and agency, and it's linked to resilience, and someone else asked about, if you make a mistake, the more that you can focus on what you learn from the situation, or what, help the other person focus on what they're learning from the situation. If you're in a complex field, as you all are, then not everything is going to go right. There is nothing in science that is ever completely, at one end of a spectrum of completely perfect or completely awful. And, we're constantly on a probabilistic spectrum where, things will go wrong. And so, what we can do as professionals is to be agile and compassionate and self-compassionate, and learn and be willing to learn, and not to shut down, not to stay with your stress response where you're being defensive, you're in fight or flight, but to actually say, okay, so this happened, what do I think I can learn from this? And that is been shown in all sorts of complex situations, not just in healthcare but in every field, to be one of the best ways of finding your feet again after something goes wrong.
Thank you. Mark, do you have your own thoughts about that question?
Yeah, I think, no one does mistake deliberately or do errors deliberately. And the very fact that someone feels bad about it means that they recognize that something didn't go quite right. And we shouldn't be working in an environment where you need to feel blamed or bad about that happening in that way. It's good to recognize that something didn't go so well, but we all do very complex, risky things every day, and mistakes happen, but the important thing is to learn and grow with them, and having a supporting environment that can enable that is really important, and having someone you can talk to. I mean, if it's an error or mistake, you need to talk to someone about it and build from it, I think.
Brilliant. And we're going to have to finish in a moment, but just as a finishing bit, in your own conclusions, what would be one thing you'd either just like to reiterate or confirm or add to the conversation we've had tonight?
I would say that professionals often focus enormously on the quality of the output that they're creating, but they focus a bit less on the quality of the input, which is themselves, is their abilities, is their talents, is their stamina, is their energy. And it's really important, if you care about the quality of your work, to also care about the quality of the inputs that you're putting in. And that means looking after yourself. That means figuring out a way to be at your best more often, and not seeing that as a nice to have, but seeing that as central to your ability to be at your best more of the time.
Aman, have you got final thoughts?
I would just say, be kind to yourself and be kind to others.
Mark?
Yeah, look after yourself. Don't play second fiddle to the job. You are the priority, and the well-being of those around you and your patients will benefit from you looking after yourself as well.
Yeah. I mean, just the fact that you're all participating in this, to me, is a sort of example of kind of commitment, care, kindness to the people you're working with, your understanding and empathy. So literally just in real time, this is an example of all the things that you've just been talking about. It's been fantastic having you all. I mean, it's gone so quickly. And we've only really scratched the surface. Go on, Aman.
Chris, I've been reflecting on your question, and I did say what I wanted to say, but I also wanted to add, and know that all of you are doing something really good.
You've just ended the webinar on a perfect note, Aman. Thank you all for participating. Thank you very much.
Thanks very much.
Thank you.
Good night.
Right.